en el contexto de todo lo que viene a continuación. En segundo lugar, le voy a ceder la palabra a la doctora Sharon Boger, que nos va a hablar acerca de las alteraciones sexuales asociadas al tratamiento de cáncer de mamá. Doctora Boger.
Thank you so much for the invitation to be here. It's a pleasure to be with you this morning. So we'll start the day early talking about sex, okay? We'll be ready to wake up this morning. If I can do it. Moving forward. Sexuality and quality of life is a very important topic, especially for young women. As recognized by the World Health Organization, sexual health is essentially a fundamental human right, and it's an important aspect of human experience that is involved with quality of life. We know when women have sexual problems, sexual dysfunction, this is associated with increased anxiety, depression, and relationship stress. And we also know that when sexual health is going well, that this experience can ease anxiety, can release stress, can maintain a sense of connection, and ultimately I think it helps women with the experience of recovery. This is the hardest part of the talk. So ultimately, how we conceptualize sexual health after cancer is as a multi-dimensional experience. This is about mind and body and relationship and a sociocultural context. So we talk with women about this experience in this larger multidimensional way, and we talk about the need to think of mind and body and relationship as mapping onto each other, as being consistent with each other. When there is disruption in any one of these domains, we know we're going to have a problem with sexual function. So the good news is that women are surviving breast cancer. We know we have an increase in breast cancer survivors, although not enough. The bad news is that all of the treatments that we use can have a very negative impact on sexual health. So whether we're talking about surgery, radiation, chemotherapy, or hormonal therapy, all of these treatments can also impact sexual function. We also know that sexual problems are probably some of the most common and long-lasting consequences of breast cancer treatment. Most survivors report at least one major and long-lasting problem, so that these are not problems that go away by themselves or go away quickly. We also know that sex is one of the first aspects of normal life that women talk about being disrupted. And the majority of survivors will tell you that they were not prepared for dealing with these significant changes. Women at increased risk for sexual problems, partly just by virtue of being younger, one of the risk factors. We know that if women struggle with sexual problems previously, they're more likely to have more problems after treatment. If women are struggling with a history of depression or anxiety, or if there are already relationship difficulties, or women, for example, who are not partnered, who are single. These are women that we need to be more concerned about, who are more likely to have issues later on. These are probably the most common sexual problems that we see. Changes in body image and self-esteem, premature menopause, which we will talk about and continue to talk about through this conference, I'm sure. Pain, decreased physical arousal, decreased desire, and for single women, lots of questions about what to do after breast cancer, issues with dating and relationships and how to communicate about this issue. I also want to say that we know that there is a significant lack of communication between medical teams, between doctors and patients about sexual health across the board. It is often unclear when we speak to physicians who's responsible for bringing up this discussion. We did a large study with primary care doctors who treat cancer survivors, and over 65% of those primary care doctors said they didn't feel prepared. They didn't feel they had any training in how to talk about this. Doctors certainly have a lack of time. People will say they don't want to make their patients uncomfortable. And again, I think most of us don't get any training in this. So that's the background to all of this, which is that for many patients, this feels like the expression in English is the elephant in the room. This is a big issue that no one talks about. So how do we start? Well, certainly there are structured assessments. There are plenty of questionnaires, short questionnaires that physicians can use. Typically in clinical practice, we don't use those. But I have two phrases here that we find very straightforward. For example, people can say, do you have any concerns or worries about how your intimate relationship has been affected by breast cancer treatment? Is it something you'd like to talk about? Or in my experience, many women find that this kind of treatment can affect sexuality. Do you have any questions for us about this? Straightforward questions. Most women never hear these questions from their doctors. So the program that I want to talk with you a little bit about at the Dana-Farber is a sexual renewal program where we assume that women have to address issues with their body, with their thinking and feeling, and we have to take into consideration the social context that they're in. This means that we think about sexuality in the context of general physical health and also global vaginal health. We also think about, again, how women are thinking and feeling and what their experience of motivation is in this topic. And again, what's happened in their relationship situation. Were women having trouble before they had breast cancer treatment? Was sexual health something they were struggling with before they got cancer? We need to know that in order to find the best way to move forward. So we start talking about the body. We think it's critical to restore overall health and well-being and think of sexual health as just part of that. It's not special, it's not different, but it's just discussed in a very matter-of-fact kind of way. Critical to address vaginal health in the context of whole body health. And the bottom line is that young women feel absolutely panicked in their body after they go through this experience. It doesn't feel like it's the same body. Women feel uncomfortable, often because of physical changes. Sometimes women have loss of sensation. Women have changes, obviously, in breasts. But more importantly, women often don't feel comfortable. And if we don't find a way to help women sort of take their body back and find a way to be physically in their body and be relaxed and be able to not feel panicky, they're not going to get very far in terms of being able to sort of embrace a sexual experience without feeling quite distressed. So what does that mean? Well, obviously, sometimes there are obvious changes, reconstruction or scars or skin changes. But sometimes the changes are not obvious. And the loss of sensation, for example, is enormous. Many women have breast reconstruction and people say, oh, you look terrific, you look wonderful. But from the woman's point of view, you don't feel anything. If your breast, if nipple sensation has been a very central part of your experience of arousal and sexuality, you really have to find a way to experience your body and have pleasure with sort of a different map, a different routine. And that's not obvious. Sometimes these changes are hard to talk about. Women feel embarrassed. Women feel ashamed. Women feel that even though their partner has been very supportive, they've never really had to talk about this before. They're not sure how to start. And there's also, I think, an increasing understanding that these issues of body image and sexuality may actually be more pressing over time. So as women survive breast cancer and live longer, the worry about breast cancer may diminish, but now the issues around body and sexuality become actually more important, not less. So this is just an example of the kinds of things we focus on with women who come to the clinic. Women will want to know, for example, what can we do to improve body image? Well, we think a lot about a strength-based perspective. Focus on what your body can do for you, not just what it looks like. Focus on what your body can feel. right? So let's talk about rediscovering sensation and perception and balance. And although we understand that some perception and sensation may be quite different, it doesn't mean that you're not able to experience pleasure. We talk about having to treat your body well, even though you might feel disappointed in it, but that you need to have compassion for your body. So you need to take a very different perspective instead of just being mad and disappointed and let down, but being able to reconnect with feeling a sense of compassion for one's body. And then again, ultimately, there's an enormous focus on pleasure, way beyond traditional sexuality per se, but starting with being able to have the experience of pleasure in your body, both being able to give and receive. So again, thinking about the body, when we talk about our young female patients, clearly women who go into premature menopause feel that it is, for many of them, like driving off a cliff, driving into a tree. It's not an easy experience to go through. And the majority of women often can experience, menopausal problems that are symptoms that really feel quite dramatic. So what do we do about that? Well, I know many of us will talk about ways to address some of the menopausal symptoms, but just to clarify that for our breast cancer patients, we very quickly are often talking about vaginal health because of menopause-induced function. So also women often have questions about hormonal treatments, what are those side effects? In terms of sexual health, the results of tamoxifen are quite equivocal. Some women have sexual side effects, some women don't. This is not really relevant to our younger women, but women who are on aromatase inhibitors have significant, profound sexual side effects that we really have growing concern about how to deal with over time. So I want to very quickly just talk about how we address vaginal health with our young women, because it's a simple algorithm that most people don't hear. I think they need to hear. There are three main ingredients in this recipe to keep your vagina healthy. You need moisture, you need stretch, and you need good blood flow. And I think this is a simple algorithm that when women hear, feel a great sense of relief because there's a sense of knowing what they need to do. So what does that mean? We need to help women understand the difference between a moisturizer and a lubricant. That is, there are lubricants that you put on the surface of the skin, of the tissue, to make things slick for sex. But that's different than using a moisturizer, like a woman uses on her skin, on her face, that she needs to use in the vagina if she has atrophy. Similarly, women really struggle with pain, often because of vaginal atrophy. That tissue loses its stretch. You have that dramatic loss of estrogen, the tissue becomes very tight, becomes very thin, and women need to do work in order to make that vaginal tissue healthier. So whether that means you working with a pelvic floor physical therapist, whether that's using a vaginal dilator, we spend a lot of time talking about the issue of regaining stretch. Similarly, we talk a lot about blood flow. Now, again, it's not something most women hear about, but similarly to all kinds of other ways that we need to have good blood flow in our body to stay healthy, we need good vaginal blood flow to keep that tissue healthy. So that's another way that we can address the issue. I want to mention about vaginal dryness briefly because this is a huge problem. When a woman has vaginal dryness that's not addressed, she very quickly has discomfort, she has pain, and when you have that, you very quickly have a libido problem. So many of our young women talk about having loss of libido, and when we ask a little more about that, we understand the issues in large part have to do with discomfort or pain that's not being addressed. And this is not a problem that gets better by itself. So many women don't ask about it, they assume it will get better over time. Many problems get better if you just wait. This is not a problem that gets better if you wait. In fact, if you wait, it gets worse. So we as a medical team have a responsibility to bring up this issue. So for many of our young women, again, this is not just about sex, this is about being able to have a gynecologic exam, being able to have it comfortably, and you're in a kind of a pain cycle pretty quickly. If you start to have sex, you're having pain, it's uncomfortable, you keep going, you develop vaginismus, the body sort of self-guards, those pelvic floor muscles get very tight, and then you really are in a tough situation and you have to work harder to turn that around. So we talk a lot about managing dryness at the very beginning. We talk about this when women start treatment, not just at the end of treatment. We talk about the first line use of vaginal moisturizers, non-hormonal moisturizers. We have a lot of success with a moisturizer called Hyalogen, which is based on hyaluronic acid. This is a molecule that holds water, and people are now using this for vaginal moisturizers. We also talk a lot about what women need to do to keep the tissue around the vagina healthy, the vulva, whether that's using coconut oil, vitamin E oil, whether that's using the Hyalogen. Women need mechanical advice about how to take care of the vagina, which is really the point. Similarly, if these don't work, we will use vaginal estrogen. I know oncologists have a range of opinions as to using vaginal estrogen with breast cancer patients. We generally find that using a tablet or the ring, the S-string, is generally considered safe. It's very little systemically absorbed, and clearly women have to speak with their oncologists about that. Really important to manage pelvic pain. If women are having pelvic pain, it's an important issue that does not resolve typically by itself. We work closely with pelvic floor physical therapists. We work with urogynecology. Women need to learn to relax those pelvic floor muscles if they are tight all the time. We also will discuss a range of ways in which women can exercise those pelvic floor muscles. We also will talk very clearly about just blood flow, what it means to either self-touch or use a vibrator. But we know that when women have increased blood flow to vaginal tissue, it has a positive effect on sexual function. So for women who are using pain, we often talk about vaginal dilators. Again, this is for our breast cancer patients, but they're in great need because of vaginal atrophy. So women need to learn how to systematically use these stretchers. And often it's helpful not just to stretch the tissue, but for women to get a sense of control in their own body, to regain a sense of comfort about touching themselves and feeling that they essentially have a greater sense of control. Also important to talk about the cognitive and emotional elements of all of this. Certainly, I'll just go back for 1 second, just to say that women often have so many negative thoughts about sexual health after they go through breast cancer treatment, and often if they are not talked about, women have an automatic negative association to so much of sexuality, and we find that if we're able to talk about it, to allow women to explore what is scary, what feels shameful, what feels uncomfortable, then we can also figure out how to help change that thinking and how to give them a more positive and hopeful perspective. It's really important that women realize they have choices about how to renew sexual health. This is not something they are stuck with, but this is something that they really have capacity to improve. The relationship piece is important. Partners don't know how to help each other. Often partners aren't sure what to say. We often will do some short-term partner counseling where couples will work together on communication strategies, on helping take one step at a time to start having some non-sexual touch, to be able to begin having sexual relations, again, in a very careful, methodical way, so that it doesn't feel overwhelming. It's critical to think about behavior as the first step to all of this. Women need to feel that they have a plan, that they know how to take back so many of these things that feel out of their control. And we also know that stress management, relaxation, exercise, physical activity, all of these kinds of lifestyle issues that allow a woman to feel a greater sense of strength in her body are also helpful to renewing sexual health. So I think the final point here is that sex and desire is not a single issue. It's a whole person perspective, which we need to engage in terms of mind, body, and relationship issues. We find that if we take an integrative approach, it is enormously helpful. And I would just encourage any medical team that's dealing with young women to use all of the resources at hand, to create written resources, to develop a team to refer to. No physician is going to ask about sexual health if they don't know what to say next. So people need to have a referring team, whether that's a counselor, a physical therapist, a gynecologist that you work with, We also think it's important to give women the information about these products, where to get them, how to buy them, how to use them, very concrete. We've actually created some materials in Spanish for our Spanish-speaking population at the Dana-Farber. We have a video that was funded from the Susan Komen Foundation and a sheet in Spanish. I think, David, I sent that to you. So if anybody wants to refer to you, we have an information sheet that's in Spanish for women about tips after breast cancer, increasing desire and sexual function, and happy to share that with anyone. So thank you for having me here today, and to say that it's a pleasure to be here. Thank you.